Welcome to H&HN Daily. I'm Suzanna Hoppszallern, Senior Editor for Hospitals and Health Networks magazine. Grady Health System, one of the largest public health systems in the U.S., has come back from a deep financial crisis. Grady's leadership team developed a plan that charted a course for a more secure financial future to maintain its strong commitment to the healthcare needs of the underserved populations and strengthen its specialized medical services. Improvements and investments in information technology played an important role in the turnaround and Grady's return to profitability. Today, I'm joined by John Haupert, CEO, and Deb Cancilla, Senior Vice President and CIO, Grady Memorial Hospital, to discuss Grady's turnaround and driving change through IT. Welcome, John and Deb. Thanks for joining me today.
You're welcome. Thank you.
So in this turnaround, what was the IT strategy and the improvements that really helped?
I think when we took a look at the turnaround, we had to take a look at what our foundation looked like and what could we do based on what we had in the organization. And it quickly became apparent that we needed a rip and rebuild strategy. And so we started with building a foundation in terms of making sure we had all the infrastructure that was required, and then worked on our application portfolio.
And in that application portfolio, are you talking about financial systems, clinical systems?
Well, in our Grady way, we don't do anything small, so we completely rebuilt the clinicals and the revenue cycle system and implemented Epic in a big bang strategy.
What are some of the challenges that you see Grady still facing? You've been through so much, but what are some of the challenges that are on the horizon?
Now that we have this incredible foundation placed to support clinical operations, we now have to work concurrently to improve the quality of care delivered every single day. And we're still culturally working through what that means and what that looks like. We have these great robust tools, but we still find ourselves doing these retrospective reviews of the care we've delivered instead of concurrent review of the care we're delivering and intervening at the time to make improvement. So we're having to work culturally with the clinical side and with the folks who support the clinical side through the quality arm of the organization to really move to more of that concurrent, progressive view of quality improvement. And that's incredibly important as we move forward.
Deborah, what about you? What kind of challenges do you see on the horizon?
I feel Grady finished the first 20 miles and we're on our next. And so to John's point, I think every day it's looking at trying to simplify the processes that we have at the healthcare system, which we know is going to help reduce cost and probably one of the major drivers of reducing that cost. From a technology perspective, we're struggling because technology is outpacing our ability to secure data. So on one hand, while we have general direction and mandate of making more data accessible to more people everywhere, we're challenged in that securing that data is really kind of a new concept, and there's new tools on the market. The new tools are expensive and are not really necessarily proven. So we're challenged in making sure we can meet the demand of making this data more portable, but also more secure.
How is this state-of-the-art system and what you've done going to help you provide better care?
One of the great things about the electronic health record at Grady and what it's done for us is allowed us to provide seamless information across the continuum. As a public safety net provider, we care for a tremendous number of outpatients within our system. We operate 6 neighborhood health centers, all of which are becoming level 3 primary care medical homes. The availability of a patient's complete history for those primary care physicians is night and day improvement and being able to assess the patients and keep up with the care they've been delivered. And so already on the ambulatory side, we're able to implement best practices, best disease-specific practices on the ambulatory side to make sure that we are out in front of the chronic CHF patient, the chronic diabetic patient, the chronic COPD patient. And we've seen huge improvement in the preventive measures on the ambulatory side. And having access to that information, having access real time, and being able to track within one location all the preventive measures that have been taken. That reduces the cost of care, that reduces the number of ER visits, hopefully reduces trips to the ER, and we have seen through this initiative a significant reduction in our readmission rates, which of course is a huge cost savings.
Thank you for joining me today.